1,196 results had been received back by the public health team from laboratories. A further 1,157 had been received as of around lunchtime today. All of those tests were negative. We took the time to wait to make sure that we didn't have widespread community transmission in the northern suburbs, and I'm very pleased to be able to say that that is a very significant testing number. Many people went and got tested, and those results are all negative. It was worth waiting to be sure. It was worth waiting to be absolutely confident that our excellent, hard-working and dedicated contact tracing team, our public health team, had their arms around those positive cases and had fundamental control of that outbreak. That's exactly what these numbers show us, and I want to thank everyone who got tested. I want to thank everybody who's worked day and night to make sure that we brought this outbreak under fundamental control, and I want to thank everyone who's worked with us day and night. School leaders, community leaders, faith leaders and individual families. There are still some tests to come back, but they are mainly from people who are, if you like, isolating at home, and we are confident that with these numbers and all of them being negative, that we in fact can rule out widespread community transmission, a big problem that we didn't know about that would have become even bigger if we had pushed ahead with opening without waiting for those test results. I want to quickly run through the numbers of the day because I know people are very keen to hear our announcements about opening up very quickly. There are 91 active cases across the state, and there are 0 new cases across our state. The last time we recorded 0 cases was 139 days ago, on the 9th of June. There are 7 Victorians in hospital, and I'm pleased to say none of them are receiving intensive care. A total of 3,066,501 tests have been processed. That's 14,024 additional tests since yesterday. That, of course, doesn't include the 1,157 that have come to us at lunchtime today from the northern suburbs. They will be reconciled in tomorrow's numbers. There are 6 healthcare workers who are active cases, and we wish them well and we thank them and their colleagues for the work that they do every hour of every day. The 14-day average to 25 October is Melbourne 3.6, regional Victoria 0.2. There are only 7 cases now to the 14 days to the 23rd of October that are mystery cases, and they are all in metropolitan Melbourne. There are just 2 active cases in regional Victoria, and those 2 cases are from Greater Shepparton, the 2 cases that we've been referring to quite consistently in recent days. There are now just 4 active cases in residential aged care, and that is so important given the underlying vulnerability of that sector. They are, in essence, the numbers of the day that I need to speak to. But the most important thing today is to acknowledge that with 0 cases and so much testing over the weekend, not just in the north, but across the whole state, we are able to say that now is the time to open up. Now is the time to congratulate every single Victorian for staying the course. Now is the time to thank every single Victorian family for being guided by the data, the science and the doctors. Not letting our frustration get the better of us, but instead proving equal to this wicked enemy. Indeed, better than this wicked enemy. I am very pleased to be able to announce that from 11:59 p.m, Tuesday the 27th of October, all retail will open. Restaurants, hotels, cafes and bars, they will reopen as well. Indoor, there will be a maximum of 20 people seated with 10 people per space. Outdoor, a maximum of 50 people with 1 person per 2 square metres. Beauty, personal services and tattooing, provided you can wear a mask, will reopen. There will be a dark opening, that is to say, staff that are required to make the business ready for trading, and importantly, it's not just good enough to be ready, you've got to be COVID safe as well. They are able to attend the workplace immediately, so forthwith. They are able to do that work to be ready for midnight tomorrow night. Outdoor community sport for under 18s and outdoor non-contact sport for adults will recommence as well. The 4 reasons to leave home will be removed. The 25-kilometre travel limit remains in place, and the regional metropolitan border remains in place, but I'll come back to that in just one moment. Other major changes: outdoor gatherings remain at a maximum of 10 people. Infants under 12 months are not included in the calculation of 10, and gatherings will no longer be limited to just 2 households. There can be more than 2 households, but the group cannot exceed 10. Weddings will increase to a maximum of 10 people. Funerals will increase to a maximum of 20 mourners. In terms of faith gatherings, religious gatherings, and we know how important this has been for many, many people of faith across the community, indoor there will be a maximum of 10 people plus 1 faith leader. Outdoor there will be a maximum of 20 people plus 1 faith leader. Now, before I talk about the next step, which will be on the 8th of November, I just want to talk for a moment about in-home visits. These changes I'm announcing today don't come into effect until midnight tomorrow night. It's appropriate because dark opening, being COVID safe, being COVID ready, to give people notice, particularly given that we've got those northern suburbs tests back and they're all zero. They're all basically, they are negative. There are 0 cases from that. In terms of home visits, we're going to wait until tomorrow to give people a clearer sense of what they'll be able to do from midnight tomorrow night. There's no need, of course, for a dark opening at home, and we want to get this right. We don't want to do a bubble because we think that can be a particularly confusing set of arrangements for families, but we haven't quite settled yet, and we have to understand, and all of us, we have to appreciate that in many respects the most dangerous environment for the spread of this virus is in your home. When you have visitors, you let your guard down, they go back to their house, they have visitors, and all of a sudden we can have change of transmission that spread silently and very, very quickly. So getting this right and having it as simple, obviously as inclusive, as fundamentally compassionate as possible so that people can connect with the people that they love the most, the people that they are missing the most, that's for tomorrow, and we'll speak to that in some detail, but it will come into effect at 11:59 p.m. tomorrow night. So there's no time lost, it's just a matter of settling those arrangements and having them as simple as they can possibly be. From 11:59 p.m. on Sunday the 8th of November, I can confirm that the 25-kilometre travel limit will go and the Metropolitan Melbourne regional border will go as well. The state will be one again for the purposes of travel and movement. COVID safety will still be critical, following the rules will still be critical, but that little bit extra time means that we can align both Metropolitan Melbourne and regional Victoria at that time. Accordingly, in Melbourne, gyms and fitness studios will reopen on the 8th, maximum of 20 people, maximum of 10 people per space, density of 1 person per 8 square metres. Restaurants, hotels, cafes, bars will then move to an indoor maximum of 40 people with 10 people per space, outdoor a maximum of 70 people with 1 person per 2 square metres. In line with regional Victoria and the alignment of Melbourne and regional Victoria, outdoors, this is for faith gatherings, for religious gatherings, outdoors maximum of 50 people plus 1 faith leader, indoors maximum of 20 people plus 1 faith leader. Further, funerals will move indoors, maximum of 20 mourners, outdoors a maximum of 50 mourners. There'll be some changes to indoor community sport, so non-contact sport for aged 18 years and under, and sports that are capable of 1.5 metre distancing will be able to operate indoors from the 8th of November. Indoor pools will also be able to be open for up to 20 people. That is a flavour, if you like, of all of those different changes. Each of you have got a detailed document with you. We'll do our best to answer any questions, but as is our usual practice, if you have any questions, we'll probably take those and get you the precise wording so there's absolutely no confusion. There is time to do that because, of course, these changes don't come into effect until midnight tomorrow night, and the ones I've just read out are indeed foreshadowed for midnight on the 8th of November. On the 8th of November as well, we will also be able to fully explain to every Victorian, city and country, what the rest of November looks like and what a COVID normal Christmas will look like. We know that that longer term roadmap is very important, but we think we'll have more certainty and be able to perhaps provide more detail if we just wait these next 10 days or so and then produce those, if you like, the more complete picture for the rest of the year. On the 8th of November, we'll have the benefit of having been open for those 10 days or so, and we'll be able to complete that picture of what the rest of 2020 looks like. Fundamentally, this belongs to every single Victorian. Every single Victorian who's followed the rules, stayed the course, worked with me and my team to bring this second wave to an end. But it is not over. This virus is not going away. It is going to continue to be a feature of our lives. It is going to be a feature of our lives every day until a vaccine turns up. These are big steps. We've all given a lot. I'm so proud and impressed and humbled by the contribution that so many Victorian families have made, so many Victorian businesses have made. If this is to mean something, then we have to take our COVID responsibilities to stay safe and stay open, to stay safe and stay connected. We have to take those responsibilities seriously. There cannot be bending of rules. There cannot be people on an endless search for loopholes. We are all in this together. And just as we've stayed the course, and yes, we've stayed apart, but remained fundamentally connected as a strong and united state, we have to be vigilant in the weeks and months to come. Until a vaccine comes, there's no normal. There's only COVID normal. So much has been given to build this precious thing, and all of us need to make sure that we honour it and value it and protect it in all the choices that we make every single day. I could not be prouder than I am today to lead a state that has shown the courage, the compassion and the character to get this job done. But it is not yet absolutely finished. Only a vaccine can give us the ultimate protection against this. So we need to be proud today. We need to be optimistic. We need to be confident, but we also need to be COVID safe. And I'm very confident that that's exactly what Victorians will do. I am now joined by my colleagues and more than happy to take any questions you have.
Can I confirm that what you're saying is that we can finally get back on the beers?
I don't know that I'll be drinking a beer tonight. I might go a little higher up the shelf.
Is this quite emotional for you?
Oh, look, this has been a very difficult year. And Victorians have given a lot, and I'm proud of every single one of them.
What does it mean to you to be able to say 0 cases?
We haven't had a 0 case for a very long time. We haven't had a 0 case day. And why it's emotional today is because people have given a lot. People have done amazing things, extraordinary acts of kindness, extraordinary acts of commitment and courage. None of this has been easy, but Victorians have shown what they're made of, looking out for each other, protecting and caring for each other, but also knowing that this virus does not discriminate. This is not about where you live or what you do for a living, how much money you've got in the bank or where your parents were born. This is everybody's business, everybody's challenge, and together, as a united state, we have been able to bring this under control. A day of 0 cases is an amazing achievement, and it belongs to every single Victorian who has stayed the course and done as I've asked, worked with me and my team, a team that is thousands strong, who are doing first-class work. You don't go and test 4,000 people in the northern suburbs and come back with 0 unless you've got good contact tracing, good community engagement. And that should give every Victorian confidence that we can stay on top of this. We are determined to. But it's not up to just the contact tracers, and it's not up to just the political leaders. It's up to every single Victorian to make the best choices, to understand that there's no normal, there's only COVID normal. And if we're not safe, if we're not smart about the choices we make, then this is a wicked enemy. It's called that for a reason, because we're not driving 0 every day forever. A 0 case number today is not the same as a vaccine against this. We all need to keep our guard up. We all need to be very careful about how we safeguard this precious thing that we have built as a Victorian community, because we've stayed the course, because we haven't been pushed by the loudest voices into making irresponsible choices. The decisions we've made have given us the numbers that we've got today, all of us. The sacrifices we've made, and now we just have to lock that in by making smart choices for the future. I just you will be able to visit people. That won't be until tomorrow night, and we won't announce the details of that till tomorrow, because frankly, one of the biggest challenges we've got is settling on a model that is both simple and safe. The most dangerous place where this virus takes off is in people's homes, and it's just a function of us all letting our guard down, and hugging, and being, being close to the people that we have fundamentally missed the most: grandparents, siblings, dear friends, all of those things. We know and understand it's very challenging, but that's going to be something you hear us talk about a lot over the weeks and months to come, because if it was to take off again, that's where it will happen. Anyway, the details of that are for tomorrow morning, but this is a day that every Victorian should be very, very proud of.
Just on those household gatherings, Premier, are they likely to be the same number you mentioned a few days ago on the two-person to a household with, I think, children? And would that change likely to be immediately for tomorrow midnight, or might that be a few days down the track?
No, we aim to have that in place by tomorrow midnight, in one form or another, but we haven't quite settled on that. And I just want the public health team to be completely comfortable, as comfortable as you can be, about what that will mean. Now, I don't. Just so people have a clear understanding of why this is such a big challenge. And it's not about blaming anyone, right? If you want to write that, fine, but that's not what I'm intending to do. These outbreaks in the north, and many other outbreaks that we have had to deal with over a long period of time, not exclusively, not every single case is attributable to this, but many cases in any chain of transmission that we've had to deal with over the whole year, you can almost always trace them back to someone visiting someone who shouldn't have done that. That's all happened. We can't change that. But there will be rules on who can visit you and how often and in what numbers. I'll talk about that tomorrow. And they're not rules designed to keep people apart. They're rules designed to keep the place open and to keep the virus at bay and keep the numbers very low. So, again, there's just no debate. There is no argument. One of the most dangerous settings for the spread of this wildly infectious virus is in your home. That's how this works. And that's really frustrating, but we can't change that. We can just put in place something that's as safe as possible, but also recognises that there's a lot of pain involved in not being able to see people. So there will be visits. They will start from tomorrow night, but the exact detail of that, we're just going to spend a bit of time tonight working that through.
Sorry to interrupt. Is there scope for that to be tightened further, maybe only one person visiting for a week or so? Because two is quite a small number to begin with, so is there scope for that?
Well, the original proposition, I can't really usefully speculate, but the original proposition and what's happening in regional Victoria now is 2 adults and their kids. So that could be 3 households in one: an adult and their kids, another adult and their kids visiting another family. That can be a much bigger group than we perhaps might like in Melbourne, noting that there is a difference in terms of the virus levels in regional Victoria versus metropolitan Melbourne. I just ask people to be patient. The visits are not happening tonight anyway, even if I was to, make it up on the spot here. It's 4 midnight tomorrow night. Let's take the time to get it right. We'll be able to announce it tomorrow. I want it to be simple. I want it to be the simplest arrangement possible. But there's no getting around the fact that in-home, what happens in people's homes can often be the place where this spreads wildly. We can't change that. We just have to try and find a way to get a simple, easy set of rules that are as safe as they can possibly be.
Premier, can you wait until after the Melbourne Cup long weekend to lift that border from regional Victoria?
No. What we're doing is we're simply waiting to see how this first stage of opening goes. Do we see increased cases? We think that also that the virus picture, if you like, between Melbourne and regional Victoria will be much more closely aligned by the 8th. We just think time is your friend here. Use that extra almost 14 days, that life cycle of the virus, to see exactly what the conditions are like, and then it'll be time, because the risk will be making the point that the rules are there for a reason, and in-home gatherings can be the most dangerous anywhere, because it's just a perfectly natural thing. People let their guard down. People are really happy to see each other. It's not a formal. It's not like going to a cafe or going to a restaurant where someone is serving you, where you're sitting a certain distance away. There's only so many tables in the restaurant. The place is all clean to industrial standards, so on and so on. It is a very different environment. I don't want to labour the point, but you will hear us talk about this a lot in the weeks and months to come, because not just here, but everywhere across the world, in-home transmission of this virus is a very, very big challenge. We will have rules tomorrow that will allow people to reconnect with those that they have missed the most. But if you want to go beyond those rules, you'll need to do it outside. And we don't think that's an unreasonable thing, because outside is 20 times safer than inside.
Time limits, what are you thinking on indoor gatherings?
Look, I won't go any further than I have. We don't want to do a bubble. We think that gets really quite difficult, and we think there's a simpler way to go forward. There is an arrangement in regional Victoria at the moment. We'll have more to say tomorrow, and it may well be that we can align those arrangements later, whether it be tomorrow or indeed come the 8th.
How would you describe the quality of contact tracing in Victoria?
Well, I would point to the fact that today we've got 0 cases, despite the fact that we've had, I think, 11 plus households that across the north, not next door to each other, pretty big spread across the northern suburbs. We've had all sorts of complexity to deal with during that, different settings, different chains of transmission, different issues at play, and yet we've done more than 4,000 tests and the results are 0. So what that says to me, and what it should say to every single Victorian, is that the contact tracing and the public health response, people working day and night, has pulled this up. But it's not just this outbreak. Frankston, Chadstone, Kilmore, Shepparton, now the northern suburbs. The list goes on and on. Our public health team has done an amazing job. And there are some who, commentate about these things. That's fine. But the facts of the matter are these. It's a big team. It's a highly motivated team. They're working extremely hard, incredibly hard, and they're doing an excellent job. And they will continue to do that because there's a lot at stake. But I am obliged to make the point that no matter how good the contact tracing is, if people aren't fulsome, they don't tell the full story when they get a positive test and they get interviewed, they leave things out for one reason or another, or if people wait 3 days with a scratchy throat and a runny nose and a fever before they go and get tested, if people don't play their part in wearing a mask and wearing it properly, washing your hands, keeping your distance, coughing into the crook of your elbow, all of these things, all those rules are just as important as the contact tracing work. The contact tracing is absolutely effective, and these numbers show that for every single person across our state. But we all have to play our part too.
You've spoken about household-to-household transmission, but the Northern Metro cluster started out of the Box Hill Hospital. How confident are you that we've got appropriate measures in place to ensure that workers aren't going to be catching COVID from patients in hospitals and transmitting them to the community?
Sure, there's a couple of points here. Our PPE and the lengths that our health services go to are well above the national standard. That's the first point. Second point, Andrew Wilson, the Chief Medical Officer, and Safer Care Victoria are always monitoring what's going on in each of our health services to make sure that we're constantly improving. It's a very human thing. We're treating hundreds of thousands of patients, so many points of care, so many ways, so many individual opportunities for this wildly infectious virus to spread. That's a constant process of trying to get better and better and then better again. That's the sort of culture that we need and want, and that's what the Department of Health, hospital teams, and of course our dedicated nurses, AMBOs, doctors, cooks and cleaners, the whole team are fundamentally committed to that.
Health workers have been calling for mandatory fit-tested N95 masks for months. Where are we at in actually achieving that, and what are we doing to ensure that it's not just the doctors and nurses but the cleaners and orderlies and anyone who's in
Well, I think there's-
that
yeah.
environment who's getting appropriate
Sure.
PPE?
The best thing I can do is have the Chief Medical Officer, that is his day job, and he's spending an enormous amount of time doing that important work. He has a number of different forums that he chairs, whether it be with unions on behalf of their members, health services, experts from across that infection prevention and control field, if you like. I'm more than happy to have him come back to you and give you the most contemporary update, because it literally changes every day, because there's more and more work getting done every day. The other point, and this is not, please don't misinterpret what I'm saying, we will see less health worker infections because we have less people in hospital that have got COVID-19. Doesn't mean that there'll be zero, but we've seen the numbers go in terms of hospital worker or health worker infections have gone from many hundreds, indeed thousands, and we are now today at just 6. Now, we don't diminish the fact that those 6 people, this is a serious thing for them, for their family, and we wish them a speedy recovery. But with less patients in hospital, we will see less people in our health system infected with this virus, and therefore we'll see less change of transmission coming out of healthcare settings, just as we've seen in aged care. The point you make is right. Well, where an outbreak starts is one thing. Where it travels and how it travels is the point that I'm talking about. And you can be absolutely certain, if you go and spend time at someone's house and you feel unwell and you've not been tested, or if you've been tested and you've been told to stay at home and you don't, or someone who's close to you ignores that and goes and visits people, then you will almost certainly give it to them. This thing hitches a ride. It is wildly infectious, and its wickedness comes from the fact that people can appear perfectly healthy. Perfectly healthy. Symptoms so mild you wouldn't even register. I haven't today done my usual, and I will again. Any symptoms, you got to get tested, and you have to get tested immediately. You can't wait a day, 2 days, 3 days. I'll see if it clears up. No. In the intervening period, you will almost certainly be giving it to other people, and they will give it to other people, and so it goes. Where you start with just one case and one choice. I'll be okay, I won't get tested. That choice, just that one choice, can be the difference between many, many people finishing up with this virus. And it's not a good thing to get. We don't know, it's a novel virus, it's called that for a reason. We can't be certain what the long-term effects of this are. What we can be certain of is, for some people, it is absolutely deadly. Please, if you've got any symptoms, no matter how mild, get tested, and get tested immediately. It's a massive thing. More than 4,000 people did it in just the last 24 hours in the northern suburbs, and I'm deeply grateful to all of them.
I've just got a couple of questions on contact tracing.
Sure.
There are reports that only positive cases are being entered into the new Salesforce system instead of every person that gets tested. Is that right?
Well, we prioritise positive cases. To be frank, we're not much interested in negative cases. In the first rapid response, they can become important over time, but we have done for months now, prioritise positives.
I just understand the problem with this is when someone tests positive, they then have to be manually put into this system as opposed to their details already being there if they from 24 or 48 hours ago when they got a test. And so that's where a delay, I suppose, comes in. So in New South Wales, all the people who get tested are already in their system, so there's no delay. So the system is essentially proactive rather than reactive.
No, I wouldn't agree with that. We focus on positive cases, and that's the most appropriate thing to do. They're the people we have to get to in minutes, not hours, and certainly in hours, not days. And we've got, from time of test being taken to the interview being conducted, we are now down, the standard is 24 hours after we get notified, and the test back within 24 hours, so 224, so 48 hours, and we're getting those done, 97, 8, 9% of those within around 30 hours. That is a very impressive performance. But we absolutely prioritise positive cases. They're the people that we have to wrap a response around as fast as we possibly can.
Just to eliminate any delay or...
Well, there is no delay. I'm not
risk.
agreeing with the proposition you're putting to me. There is no delay. We far exceed the national benchmark, not by a few minutes, but by 10 or more hours. In fact, it may even be more than that. The other point to note here is, on a day like today, well, then that'd be to focus on 14,000, 15,000 people whose results have come back that are negative.
Yes, I suppose you don't have to focus on that, though. They would just already be in the system.
Well, again, we are focused on those who've got this. and their close contacts. And you don't pull up an outbreak like the one we're dealing with at the moment if you've got delays. So to report that would be fundamentally wrong. That's the point that I'm making to you.
The delay is that someone has to then manually put that positive case into the system as opposed to it would have already been there. So that's just saving time.
That isn't right. The notion that not everyone's getting tested multiple times. You assume that there is no comparison, and there is no time delay. We are in fact well ahead of the standard.
But it works so well in New South Wales that everyone that gets tests are already in their system. So why wouldn't we do this?
Well, because we're focused on positive cases, and that's the most appropriate thing to do. I suppose the reason you're putting that to me, that somehow there is a hold-up because we're doing something different, that is in no way true.
No, I suppose it's just we're opening up now, so we
are opening up.
The potential of a third wave, it all relies on how well our contact tracing system goes, that's why I'm raising the question.
Well, I don't accept the conclusion that you've drawn, and whether that's sufficient or not, well, that'll be a matter for you. But ultimately, our contact tracing team is working extremely hard. They've got technology. They've got technology that is the best in the country. Let's not be in any doubt about that. And Alan Finkel has made that very clear. The system we're moving to, I think, will be one that will be emulated by others. And you don't get 4,000 tests plus done when you've had pretty significant outbreak and they all come back with not one positive if you don't have a public health response that locks people down, wraps support around them and stops them inadvertently spreading it beyond the people who've already got it. In terms of data entry, I'm always happy to come back to you, but we are focused on positive cases, and that's exactly where we should be.
Just finally, I've just got one more. On the QR codes, I understand that DHHS has decided not to roll out the standard Salesforce QR code system. So it could be that businesses will then have to be providing the data, whether that's pen and paper or their own QR system, to DHHS. Why has that been decided?
I don't know that decision has been made, in fact. I'm happy to check that out for you, though. But there will be a mixture, because it does take some time. There'll be a mixture of some businesses that will write things down, and that'll be perfectly adequate. The cafe
perfectly adequate. It's so easy for something to go wrong for someone to write someone's number down. They could easily get it wrong.
You've got a much greater faith in IT than me, it seems. I think that often old-fashioned ways are the best way, and there'll be many, many small businesses who will write down and they will take great pride.
The problem with our contact tracing in the first place was that it was pen and paper.
No, and if you go and ask New South Wales how much pen and paper they use, and I think you might find that some of the criticisms that you level against Victoria are not accurate.
Okay, just quickly on
QR codes, I'll come back to you though. That I'm not sure whether any such decision has been made, but some businesses, like the cafe in Kilmore, may choose to continue writing down and taking absolutely meticulous records, and we thank them for that. That'll work best for them. They may transition over time to if you like, a kind of touch on as a person comes into the business. We'll have more to say about that in due course.
Around the northern suburbs outbreak, the family who sent their child to school has released an email they got from the DHHS which says that their family had been cleared to leave isolation. Do you concede now that was
No, I don't, because that's simply wrong.
So that is wrong?
It is simply wrong. No such advice was provided in relation to the child that went to school. And to speak and to speak in more detail about that, I'm more than happy to have the testing commander do that.
Was the email doctors or a bit confused?
No, we have had a consistent and very clear information provided to everybody who is a positive case. We understand, of course, as we've said a number of times from this podium over the last few days, that when there are many members in a particular household, I think in a particular household where there are multiple infections rolling through, that those individual communications could be quite complex. That is why the DHS team are in contact with individual people, every few days to check on their health and how they're progressing. That is a two-way dialogue to make sure people understand what's going on. We are there to answer any questions. It was very clear in the communication about which individual cases were being released, which members were being released in that chain, and the individual in question was due for his day 11 test on the Tuesday, which was arranged, which he did have, but he should not have gone to school on the Monday.
That
But it
email
says
states your family has met the Department of Health and Human Services criteria to end isolation. It doesn't say, you know, some of you are free to be released and some aren't. It says your family has met the criteria. Who's got it wrong here, and why can't you guys just admit that DHHS got it wrong?
Well, we didn't, because we have, and I'm not going to go through every single individual letter that we send to every single individual person who is either a close contact or a positive case. I have seen those letters. We send them individually to named individuals. There are 8 individuals in that particular household, and there is a chain of daily, almost daily, discussions, telephone calls, meetings with people to explain to them what's going on as part of that wraparound care that we provide to people. So I'm not going to, sit here and say that we are not explicitly clear about what is happening with individual members of a household of 8 people. It is entirely, we set that out very clearly. We continue to do so, and we will continue to do it because it's the right thing to do in terms of focusing on where individuals are at in their chain of transmission and what they need to do next.
Was it not rational for that family to conclude when they received a letter saying your family has met the Department of Health and Human Services criteria to end isolation, that they could go about their business?
No, because what you're taking one piece of documentation in isolation of 3 weeks, 3.5 weeks of communication with a number of people in a household where there's been a continual dialogue, a whole chain of letters and correspondence, and a whole chain of discussions. We have been very clear at every step of the way. We absolutely accept that there may have been a misunderstanding, but the information we have provided is accurate and to the point.
Do you intend in future to communicate this more clearly? And because surely it's understandable that when an entire family receives a letter like this, they get the impression.
I don't understand that, because we communicate now with far fewer people because we have so few positive cases left, and we have still a significant number of close contacts. We communicate consistently with those individuals, and by and large, the vast majority do the right thing. We have day-to-day contact with individuals to explain to them what's going on, where they're at. We test them multiple times during their period. So the vast majority of people comply because it's the right thing to do and because they understand. And if they don't understand, they ask the questions of the people who are keeping in contact with them. We will continue, of course, we'll continue to see what else we can do to make it clearer. And as the cases come down, that may become a bit easier. But I do not accept that in this case or any other case you might throw at me, that we haven't been clear about our expectations of people about what does isolation and what does quarantine mean. What I might just go on to talk about is briefly, just while we're talking about the northern suburbs, just kind of where we've landed over the last few days. As the Premier said, 14,024 tests overall across Victoria yesterday, and actually that for all of Victoria has been a really strong and exceptional response. We've conducted 16,382 tests in 6 days across the northern suburbs. That's almost 16,500 people who've come forward for testing, and that's been a critical part of how we've managed to pull up this particular outbreak. A huge spread of people across the northern suburbs really coming forward, which has been a phenomenal community response, and we're very grateful to all the organisations we've worked with to make that happen. We still have 39 active cases in that 11 household cluster. We continue to support and monitor those 39 individuals, and we'll continue to work with them over the coming weeks ahead as they finish their isolation period. We also have about 317 close contacts that we've tested over the last few days. Those tests were done door to door. We had teams out over the weekend, especially working up to 10 p.m. at night, contacting these close contacts, making sure they got tested, making sure they had the care and support that they needed to have. We also tested 108 people at the Regis McLeod Aged Care Facility, all staff and residents, and to date all those tests have come back negative. As I've said, this has been a really important community response. There have been many, many conversations which continue and will continue for many days ahead with a whole range of community leaders to ensure that people understand the message and to ensure that people have the support they need to come and get tested. And those have taken a whole variety of formats. I'd particularly like to recognise and respect and pay appreciation to the leadership of the East Preston Islamic College. They have been phenomenal in driving this response. No school could have done more. No school could have done better in actually dealing with the outbreak they saw a week ago and supporting ourselves and the wider teams and supporting their school pupils and their school families to come forward. That asymptomatic testing program will continue over the coming days. We continue to provide a strong community presence there and a strong testing presence to ensure that anybody in the northern suburbs who still doesn't feel 100%, please still come forward to get tested, because the only way we can maintain the easing of restrictions that we have is to ensure that any other traces of the virus out there, we pull them up really quickly. We rely upon you to do the right thing, to get tested really early on, so we can support you to ensure it doesn't spread any further to any family and friends.
So just to clarify, why did the letter say your family has met the criteria to end isolation rather than some members of your family have?
Again, there is a whole chain of communication with every single individual who's been involved in that infectious period. I don't have that whole file of correspondence with me. I'm very happy to bring it along at some point and go through it. But we have been explicitly clear with every single individual in that household, in the 11 households, about what's going on.
Rather than digging in and sort of we're hearing a defence of that letter, it's obviously caused an issue. The students gone to school, the families thought they were okay to be there. So obviously there's something that's gone wrong in the communication between the department and the family. So what are you doing to look at how you can change that, how you can do it differently next time to make sure this doesn't happen again?
Yeah, sure. Look, and I think, as we've discussed, I think in recent days in these press conferences, look, we continue to look at ways at how we can improve communications and understanding. We produce all of our information in multiple languages. We use bilingual workers in many of our case contact discussions. Half of the people, the hundreds of people we had out there doing the testing program, doing the follow-up with close contacts, are bilingual from various other communities. So we invest a lot, and rightly so, because this is something that affects all communities in Victoria.
It's not just about the language barriers there, though. It's about the clarity of communication, which isn't a matter of ESL. It's a matter of...
No, absolutely. Look, and I think we continue to also work with schools in this regard. So as I think we discussed a few days ago, we're working very closely with our education colleagues, education teams embedded within our wider public health response, to ensure also that schools understand if there are students registered at schools who are either positive cases or close contacts. We now have processes in place to ensure that those school principals are aware, so they can also be on the watch out and work that through.
But at the end of the day, if a family is misunderstood and sent a kid to school, that's your problem, isn't it?
Well, yes, but as we've said before, I mean, everybody here has a responsibility. So we work tirelessly and will continue to do so. So anything we can do to improve our communications and to improve the support for people. But as we saw at Broadmeadows, at the house we looked at last week, as we've seen in every single response, the number of people that are deployed to support people in their homes, the number of people that are deployed to talk to people on the streets, to follow people through, is immense. This is a huge public health response, not just by people in our department, but by community health organisations, private health networks, local councils. We work with all those parties. So there is a lot of effort, and rightly so, because we want to look after the individuals concerned. We also want to make sure they're getting the support they need. We also want to make sure they do the right thing. So people do have a responsibility. If you're not clear, if you don't understand what we're asking you to do, then please tell us. We talk to you every day. Please tell us.
Part of the issue is about that multitude of people contacting them, though, and in some cases people getting different advice on the 6 phone calls they're getting a day. So I know you've promised an outbreak case or a case manager per household. Will you also do that for close contact households and secondary contact households?
Look, I think we continue to improve and see how we can do that kind of case manager for households, particularly large and complex households, and each case is different. I mean, the outbreak we've been dealing with here is very different to Shepparton, it's very different to Kilmore, different to Chadstone. So we continue to look at what's the dynamic of the outbreak. If you're dealing with one in the workplace, it has a different characteristics to one dealing with multiple complex households. So yes, we adapt our approach each time. If there are ways for us to continue to better support individuals, we do that. But we do that by talking to the individuals and saying, what support do you need and how can we best provide that?
I guess some Victorians might listen to this and go, well, hang on, it's now October, end of October, we've been in this since March. Why are we still making these constant changes and improvements?
But equally, I think Victorians would look at this and say, well, hang on, we've been at this for the last 6 months. How is it that people do not understand, if they're caught in those situations, that if you are a close contact or if you are a positive case, you can't go out and about? As the Premier said, you might think 6 months in that people understand the message that says you can't visit each other in each other's homes, yet we still find cases where that happens. So I absolutely accept that we can continue to improve our communications and support of people, But I think you have to recognise the huge amount of support we provide to people. And in all my conversations with families, with leaders, community leaders, school leaders, faith leaders, the overriding feedback we get is you guys are putting a huge response out there. We had literally hundreds of people out on the streets of the northern suburbs over the last 4 or 5 days, and rightly so. We had people going into people's homes saying, we want to make sure that you as a secondary contact, 400 odd people, that you are being tested. We're not going to ask you to go to a testing station. We're going to come to you because it's important to all of us that we do that. That's how our response has moved on.
Can I just clarify what you're saying too, is that with this northern suburbs outbreak, families have done the wrong thing by visiting each other, and that's how it's spread. Is that what you're saying?
No, I'm saying that as an element of one of the challenges we've had to deal with in this outbreak and many other outbreaks.
So just stick to this outbreak in particular, because we never really got, yesterday you didn't have the details of how it spread from household to household. So have people done we didn't have all the details of that yesterday.
No, but this is about how do we respond to 39, in this case, 39 positive cases in 11 different households, and how do we protect the rest of the Melbourne community from that particular outbreak, right? So it's not, I don't think it's a particularly helpful narrative for certain elements of the media to be going after individual families, to be going after whose fault is it here. It is nobody's fault that coronavirus comes into your community or into your household or into your workplace. This stuff just happens. If people follow the rules, and if we provide the right wraparound response around it, we can contain it really quickly. Now, I would have liked to have contained this one at 6 households that we had a week ago. In the end, it spread to 11 households. That is regrettable. There is nothing that we could have done that could have prevented that. But we've pulled it up where we are now, and we'll continue to support those people to follow it through.
And sorry, the scrutiny isn't of individual households or communities or anything like that. It's about whether the rules are working or whether the rules have been broken, and therefore that's why this is happening.
No, so I think what the overriding impression, and why we're here talking about a zero case day after 14,000, 15,000 tests in the last 24 hours, is because overwhelmingly people have followed the rules for the last 4 or 5 months.
We're talking about the northern suburbs outbreak.
But
I'm just trying to get a clear answer on that, on whether it has spread, because people have visited each other's. And it's not about targeting any community, it's about asking a question, because that tells us whether or not the rules are working.
Yeah, look, and absolutely, have there been people moving between houses? Has there been people who haven't followed the rules in that case? Absolutely, that is an element of what's gone on here. But this is fundamentally a story of how do you pull up a large and complex outbreak, which is what we've been doing.
Let me just add to that. Can I just say on the issue of, you can't change things that have already happened. That's already happened. But the reason that I mentioned the fact that some people have been visiting each other, and the reason that we're not accepting the notion that we didn't do everything we possibly could to make sure that family had the best possible information, is that it's not fair on the thousands of people who are out there working, delivering 0 results, and even more, because we got the lunchtime batch came through as well, 0. It's not fair on them to read down from this outbreak or any of this commentary about the fact that it hasn't been well handled. That's just simply wrong. They're all out there working as hard as they can, and they've pulled this up. This is a very clear demonstration that not only are there a lot of them, and they're all working very hard, but they're doing the best of work, and they are limiting these outbreaks. Now, 6 months ago, would it have stopped at this? I don't think it would have. There have been changes, there have been improvements, and on the question of, well, why are we still improving? We always have to be improving. This is not static. The virus is not static. Circumstances change, and we have to change too. So it's a kind of cultural thing. Every day we should be looking for minutes even. Are there things we can do that'll make our performance even better, even stronger? And if we can prevent even one extra person from getting this, then that's worth doing.
So on those improvements, can I ask, Alan Finkel's obviously been in close contact with you. What further recommendations for improvements has he made?
I don't think there are too many, actually. I think that what we have set in place, I'd need to go and check, but nothing that's noteworthy, nothing that's going to get us hours. The path we're on, and we've worked very closely with him in terms of both the Salesforce product, but also the defence science product, which is about trying to interpret things and see links that aren't necessarily obvious. We've worked very, very closely with him, and I think there were some detailed meetings on Thursday last week, and I think it's fair to say that that Alan is more than comfortable with the progress that we've made and the settings we have in place. And in fact, I think that there are other states who are looking at what we've done, and they may well copy some of that, which is, I think, which is a good thing.
With the date of November 8, is that
Yes.
locked in? Because you say in your press release, if we can continue driving case numbers down, then those changes will happen on November 8.
Well, there's always barring a day where we have, or a series of days where we have very high case numbers, then we will make these changes. These changes will occur. If the trend that we're seeing now continues, and it doesn't have to be zero every single day between now and the 8th. That's not the strategy that we're after. If we continue to see small numbers of cases, we always like it to be zero, but small numbers of cases, and a continued drop in the mystery case number, and again, numbers become, this is a point we've made a few times, but I'll make it again, because arguably on a 0 day, it's more important than ever. The numbers are not so much the issue, it's the stories that sit behind them. We have some tests that will come to us later on tonight, and they'll be of people who are close contacts of other positive cases from the northern suburbs. We don't want any of them to have this, but if a handful of them do, they're at home. They're not going anywhere. They've been locked down, as it were, with getting all the support they need for days now. So it's always the sort of, that narrative and the story that sits behind the numbers is at this point just as important as the numbers themselves.
And this is the second time. This is the second time Melbournians have been in this position where we're coming out of lockdown, and then we only had a few weeks of it, and then we're back in lockdown.
Yes.
Hotel quarantine happened, and flow on from that.
Yes.
How certain can Melbournians be that we won't be going back into lockdown again in the near future?
Well, if we all work together, the government will play its part, our big team of public health professionals and others will play their part, and if each and every Victorian plays their part, following the rules, because the rules change, and that's a great thing, but there's still rules. It's not normal we're trying to find COVID normal, and I'm very confident that we can do that in the days and the weeks to come. If we all play a part, then I'm confident that we can keep this at bay. That doesn't mean it's zero every single day. There will be cases, there will be outbreaks. But what the North has shown us is that through a lot of hard work, many, many thousands of hours of work by a big team, and all of our partners, school principals, faith leaders, everyone, we've been able to pull this up at a relatively small number of cases. I don't want anyone to get this, and we're all working hard to try and prevent that. But it is a partnership. Individual families, ordinary hard-working Victorians, they've got to play their part as well. It's not something it's not a command and control thing that the government can do it all. Individuals have to make really good choices too. And whilst we've seen some people who haven't made good choices, we shouldn't take away from the fact that the vast majority of Victorians own these numbers. They have delivered these numbers because they've stayed the course and they have done everything that's been asked of them. I'm proud of them, I'm grateful to them, and I'm confident that they'll keep doing that hard work. And that's what will keep a third wave at bay. That's what will see us find that COVID normal and lock it in until, of course, a vaccine turns up.
New South Wales.
Sorry, can I ask about office workers? There's a lot of people that want to know when they can go back to work. It may be a question for Brett, and when they'll be able to go back to offices themselves.
If you can work from home, you must still work from home. And when we can update people on that, when it's safe for us to have people going back into office environments with rules, then we will do that as soon as we possibly can. If we were to call it now, it would be much later than if we wait until the 8th of November, and then we might be able to have a bit more to say about we will be able to have more to say, about what those next steps are. Another 10 days, 2 weeks worth of data is critical just to give us a sense of where we're at that point. Again, nothing is ever chiselled in stone with this thing because it can change. It can change really, really fast. We'll get people back to offices as quickly as we can, as safely as we can, and there will be rules. It won't be everybody going back. It won't be everybody in these kind of de facto crowds of 20 or 30 or 40 people all jammed in close, for hours on end. We've got to be very cautious about this.
Are you looking at that before the end of the year? Are you hoping to get people back in offices?
I think I was asked this the other day, and I'm just trying to be as clear and as honest as I can be. I don't have the answer to that. And as soon as we do, then we will let people know and we'll give people notice. If I had to call it right now, then it's still some way off because it does present a very high risk. That can change as things unfold. And as soon as we're in a position to give people certainty about that, we will. And it's not just from businesses who are paying rents. It's also about getting people back into the city, getting people spending, getting people going to restaurants and cafes and bars and everything that are now open, retail, all of that. But it just has to be done in a safe way.
Premier,
Can I
just
ask
on New
as well,
South Wales.
just on masks, are they, they're here to stay, do you
They
think,
are.
until the end of the year? Are we
Well, we
wearing
can't be
masks?
certain. It's a little bit like the first question, but we're not indicating any easing of masks today. Masks are incredibly important, difficult, not particularly pleasant, but for a very low cost, we get potentially a very, very high benefit. And that's why we're going to persist with those for a while. We're not quite sure how long. Maybe that the settings change potentially, but masks are going to be, particularly when you are going to be proximate with other people, they're going to continue to be a feature. It's a very low cost for a potentially very big gain.
And people are also asking about
Sorry?
attractions like the zoo, about the zoo and things like the aquarium. When will we be able to visit those?
Aquarium's a little bit different because it's obviously indoors. Outdoor activities at the zoo with those limits of 10, that would apply there. We're more than happy to have some we will have consultations with some of those large venues, I suppose you'd call them, and then we'll try and provide some clarifying advice to people over the course of this week.
Just on New South Wales using pen and paper as part of their contact tracing, they just eased restrictions last week, and in their media release it says businesses wishing to take advantage of this relaxed restrictions must use electronic means like QR codes to record and keep contact details. So it seems they really are moving away from any pen and paper for businesses to reopen. Seeing as they've done such a great job, do you think it is important for businesses to use QR codes?
Well, we'll have more to say about that in due course. This is a press conference today from the Premier of Victoria about Victorian restrictions. And the evidence that I have presented to you, the facts, the zero number today, is a cause for us to be confident about the work that our dedicated public health team is doing in partnership with communities who know that we are all in this together. You can ask me about whatever states you like, but today I would have thought...
I'm asking about Victoria.
Well, today is a day for Victorians to be very, very proud. But I've already indicated to you, I'll come back to you on QR codes.
You did indicate that New South Wales used a lot of pen and paper.
Not in relation to... what I said to you, it wasn't in relation to shop fronts or points of sale. It was a broader point than that. But in any event, I have not turned up here today to talk about New South Wales. I'm here to talk about Victoria and the fact that every Victorian should be very proud of the precious thing that they have built, and that is not only a day with zero cases, but a day where we can confidently announce that we will open up, first of all from midnight tomorrow night, and then midnight on the 8th of November, at which point we'll have more to say about what the rest of November and December looks like as we push on to a COVID normal Christmas.
On the northern suburbs outbreak,
Sure.
that was able to spread quite rapidly and quite far.
Yes.
Is anything being done differently as we open up? Because obviously the risk of spreading, increases as we open up. So is anything being done differently to try and alleviate that risk?
Oh, look, there's very little that you can do to change the fundamental nature of this virus. It moves swiftly, moves very, very swiftly. And that's why a small number of cases can become a large number of cases very, very fast. That's why we've all got a part to play, whether it's the public health team or others in a local community or indeed families.
I suppose the point is if it can spread that quickly during a lockdown, is there a concern that, if that was to happen...
Well, I would just say to you, there are many hundreds of thousands of people who live in that part of Melbourne, and we've got about 30-odd cases out of this. And I'm not making light of that. We don't want anyone to get this for all the reasons that I've outlined. But to pull this up as quickly as we have, and the thing about it is, yes, we're locked down, but if people amongst that group are off visiting each other, they've not been locked down anywhere near as much as they should have been, is the point that I'm making. So we will see that. There will be from time to time people who don't do the right thing. We can't change that. We can just appeal to people. The rules are there for your family and every family. It's not about being against a given family. It's about actually supporting them to stay safe. So these rules are very important, and they're about keeping us open, particularly as we start to ease. The point you make is a very good one. But the performance in the north is a credit to the people involved in it and an absolute reflection of the quality of the work that is going on, and it is to the highest standard, and Victorians can have confidence in it.
And
Can it be better still? I'll never stand here and say that it's perfect. No system ever is. No system will ever be perfect. And that's why every single day we're looking for minutes and hours, for an edge, for a learning that we can put in place. That is the appropriate culture. This enemy doesn't stand still, and our system that's there to fight it shouldn't be static either.
Another question on the personal care industry.
Yes.
Skin clinics are worried that they won't be able to reopen, or they'll lose about 80% of their business if clients have to wear masks. So.
Yeah.
So, and there's also no indication about when that will change in November 8. So, in their industry, I know masks, as you say, low cost, high benefit. For them, it's a high cost because they can't treat their clients. Would they be able to get an exemption, or would that be able to get looked into so they'll be able to operate?
I think
because they're quite trained in infection control.
Yeah, no, I fully understand the issue that there will be some care, some services that would not be appropriate or can't be conducted if you're wearing a mask. I'll just give you the gyms example. If you'd asked me 2 months ago when would we get the gyms open, I probably wouldn't have thought we'd be able to get to the point with what we've announced today. So we're always happy to work through issues and to try and make what is an inherently, from a coronavirus point of view, an inherently risky setting as safe and open as we possibly can. Let's take that offline. I know we've had some discussions with that sector, and some were not happy. Some are not happy about the mask because it is a material issue, but we're more than happy to chase it up.
Can I just ask one more question of Jerome?
Further Brett's questions on future restrictions.
Yes.
There'll be a lot of businesses who will begin to operate in fear of another lockdown when another outbreak occurs.
No, they shouldn't do that at all. They shouldn't do that at all.
That wasn't the question.
Good, but let me just deal with that really quickly before you get to your question. That's not the way to go about this. We should be alert about this. We should be vigilant. We should know that this has not gone away and that there is no vaccine. But this is not about being fearful. This is about being confident in the systems and processes that are in place. They have, with the hard work of Victorians, delivered these numbers. What's more, if we all play our part, then yes, there'll be cases and yes, there'll be outbreaks, but they will be well managed if we all play our part. So no one should form that view. We can find that COVID normal and we can lock it in, and we will. But your question was something else.
In much of Europe and many other countries, there are thresholds and trigger points for when restrictions are reintroduced, and those are things like test positivity rates, cases per million. Is that being worked on? Are those thresholds being created? And if so, will they be made public so that businesses have absolute certainty on when they might be asked to shut down? Sure.
I will have more to say about all of the balance of November, the balance of the year, and the settings for 2021 quite soon, on or around the 8th, when we start to map out some further steps, and we'll speak to some, maybe not all, but certainly some of those issues then. I can't guarantee that an individual business will not be shut down. If there's an outbreak in your business,
I meant broadly,
then you may well be shut down. But our aim, and if we all play our part, then we can avoid having to shut the place down for a third time. That's what we're all working towards. But I can't do it on my own. Even the 2,500, 3,000 people, and many more than that really when you start to think about everybody who's working on this, even thousands of people cannot do it on their own. We need individual families to make really good choices.
Will you commit to some sort of certainty around reintroducing restrictions? Will there be a well-known understanding across the board of
we're certainly happy to
when
give
rules
people as much
change?
information as we can, but I think that what's much more likely is exactly what's occurred here and exactly what's occurred in recent outbreaks, where cases, their close contacts, and then from an abundance of caution, all of their contacts, so it's many hundreds of people. In fact, I think various outbreaks across the last 3 weeks or so, we've had up to 1,000 people that have been in their homes waiting to see whether someone they're connected with tested positive or negative, and whether that chain could be broken and then they could be let go back to something approaching normal. That means you lock up or you isolate hundreds and hundreds of people so that hundreds of thousands, indeed millions of others can go about their business, go about their COVID normal business. We think that's the very best approach, and it's an approach that you can only deploy when you've got numbers very low. If you tried to do that when you had numbers much higher, well then you would be like no reason to leave whatsoever from your home, and it would have been tens and tens of thousands of people, which would have been rather challenging. We think that graduated way of doing it, whether everybody who's got any link, even a kind of tenuous link, they are isolated until we get the test results, and then we can either confirm that they're in ISO for a period of time, or we let them go. That's a much better way of doing it, and the point of that is to try and do everything we can to avoid having to have statewide settings or metro-wide settings. That's the best way I think I can answer your question.
Wasn't what I was asking, though. I understand that will be the approach for outbreak management, and that's excellent. But
yes.
Businesses, when they saw an outbreak like this over the weekend, there were lots of questions around, if we're 2 weeks from now and we see an outbreak like this again, will that send us back into lockdown? Given how long the lockdown has been, that is an understandable anxiety.
Sure.
So will there be clarity around what would trigger another lockdown?
I don't think there's going to be
some triggers not be public.
Well, hang on. Well, I'm not making any announcements about that today, so I'm not going to speculate at length. What I will say to you, though, is this much more targeted approach is designed to avoid any thresholds like that and the need to go to those sorts of lockdowns. Every single outbreak, every single case will be treated on its merits and the most appropriate response to it, not to the state, to that outbreak. That's what we will do. And if we continue to do that well, and we will, and Victorians continue to work with us, as they have done, then we've got every chance of pulling it up and not getting to a situation where we need metro-wide or statewide rules back in place. We want to try and avoid that. And if everyone plays their part, we can be confident that we will be able to do that. And that, when I say everyone, that's not just the people who do this 24/7, but it's every family. Every single family in our state has to preciously guard what we have all, as Victorians, built. It's fragile. It's always going to be fragile until a vaccine comes. But the fact we've been able to do this should be something that we are positive and optimistic about and confident about. Not fearful, just vigilant and smart about the fact that there's no vaccine. I haven't got a vaccine. If I had one, well, then this would be a very different press conference and a very different year. You absolutely can. Is there any more for me before they'll get Jerome back here? He's been known to get on a bit of a roll. So
we've seen a level of surveillance we've really never seen in Victoria before for civilians.
Yes.
Police and ADF patrolling our parks, our beaches, that sort of thing. When does that end?
Well, I think there's going to be rules that'll be in place for a long time. And you have rules in place to protect people, the vulnerable who die if they get this. Others who are perfectly healthy, who if they get it can become very, very sick. And who knows what the long-term consequences will be. And of course there's all the pain that comes from having to lock the place down. So the rules are there for a reason and they have to be enforced. I think Victoria Police have done an outstanding job in often very challenging, well, shameful circumstances from time to time, but they've done a very good job. And the rules are there. The rules are there to protect everyone, so they'll continue to be enforced.
And I'm talking here not about the anti-mask protesters, that sort of thing, but ordinary people. When will they expect not to have to, sitting in a park, having to speak to officers about what their purpose is there? No,
well, look, I think as the rules are further eased, as we find that COVID normal, then perhaps some of that activity will be less a feature. But in my experience, those who are doing the right thing, which is the vast majority of Victorians, they're only too happy to have police and authorised officers and others moving about, making sure that everyone's doing what they're doing, the right thing, because they're making a powerful contribution to getting the numbers low and keeping the numbers low. We don't want a situation where people are having to enforce the rules themselves and telling the person next to them, put your mask on properly. That can be a bit challenging. But again, let's not lose sight of the fact that despite some pretty colourful examples, and some worse than that, the vast majority of Victorians have done the right thing, and that's why these numbers are low. And that should be a point of pride.
Premier, is there any update on state borders? I know our border is open, but seeing as we're out of lockdown, has there been discussions about when that will be able to reopen?
Not yet, but I will... there were some discussions on Friday at National Cabinet about that, and we've all signed up to that placemat, the notion of being there by the end of the year. I think that we will get regional Victoria open to New South Wales and to SA as soon as we can, and that's likely to occur before necessarily Melbourne opens up to those states. Although, I've said this many times, but the one thing we could do, and we have, is get our numbers down, and that gives others the comfort that they need to be able to open up. So I'll probably have some conversations with Stephen and Gladys and others throughout the course of this week, just so they're crystal clear on what we're doing, what the roadmap says, what our steps are, as well as making sure they've got all the data they need, so they've got a complete picture.
With the benefit.
On the crowds that come out, and then also on Boxing Day test.
And on Halloween.
And here was me thinking that I'd get out of a press conference without talking about Halloween. And
Sorry.
this is in honour of Alex. This is anyway.
Take it over.
Very good. We'll come back to you on all of those.
Oh.
We'll come back to you. Racing, we'll finalise that in the next 48 hours. There's a reference made to it in. I don't think so. I think it might more those who might be connected with the running of the race in very small numbers, because that's what's happening in regional Victoria.
And
just before we get into any debates about what didn't happen last weekend, if with parity with regional Vic, then there are some people who are allowed on course. For instance, cafes and restaurants within the precinct, they're open. So we have made a big shift. What was not appropriate last Saturday may well be appropriate this weekend or the weekend after. We just have to work through that, and we haven't done that yet.
Were open at the Cup.
Sorry?
If cafes and restaurants were open inside the Cup, is that what you just said? Sorry.
There is a chance.
Yeah.
There is a chance for that, but we're finalising those arrangements,
Yeah,
and we'll be really clear about it in the next 24 to 48 hours.
But if that were to happen,
Yes.
would that mean then that the limits on patrons that attach to restaurants outside of the Cup could attach inside the Cup? So
It could potentially, but we have to be very careful here. We do not want a de facto crowd by virtue of the fact that people have gone to every one of these separate eateries that are all next door to each other, and then all of a sudden we've got a crowd. It's a very special day, but no horse race is worth setting us back. So we'll have more to say very soon about that. Boxing Day test is very different because, of course, that's some way off. I'm very confident that we'll get a crowd at the G for the Boxing Day test. I don't know how big it'll be, but there will be a crowd there. That's the advice I have, and that's what we're working towards.
On the hotel quarantine, have you been asked for an extension? And
No.
Are you aware of any witnesses being recalled?
No on either of those, and if that changes, certainly in relation to, I wouldn't necessarily be aware of what others might have been asked, but on the extension, that would come to me if it did, and I again will commit to you. I'll tell you if that happens.
And can I genuinely confirm, will we get an answer on Halloween tomorrow?
Absolutely, I'm going to
What's
make it a
reading
priority
about
of my
it?
work this evening.
Can we go back to Jerome?
You certainly
No one
can.
has any other
Oh,
questions.
He may
sorry.
know the
Sorry,
answer
I
to
do have one
Halloween.
last question for the Premier.
Sorry, yes.
With the benefit of hindsight, what would you have done differently throughout this pandemic?
Well, I don't have hindsight. None of us do.
But
All we have is hard work and an absolute determination to not listen to the loudest voices, not be pushed to ignore the science, not listen to those who would appeal, for us to act out of absolute frustration and nothing more than that. None of those things work on this. You've got to have a strategy, and you've got to have the character to see it through, no matter what's written, no matter what is said. This is not about politics, and it's not about popularity. It's a pandemic. And I just want to take this opportunity to thank every single Victorian who has followed the rules and done an amazing job. I could not be more proud than to lead a state who has shown its true courage and commitment to each other. That's what these last weeks and months have been about, and that's why we can make these announcements today. Jerome.
Thank you for coming back. Can you confirm there are still 2,600 contact tracers? Is that right? Thereabouts?
About that number, absolutely.
Can you give us a breakdown of how many are in-house and how many are contracted through an external company, and what that external company is?
Not right here, I can't. We can certainly come back to you on that question.
And can you, sorry, just so you know what to come back to me with, the company that they're contracted to, or the contract is with, and the breakdown of how many in-house and how many
Sure.
there, that would be appreciated.
Yep.
And a quick question too, sorry, just to go back to the graphic that DHHS put out about that outbreak. It looks like some of the households, there was some delay between the diagnosis, but it's sort of spread quite quickly with a couple of days in between.
Mm-hmm.
That indicates to my uneducated eye that there may have been some delays in isolating or contact tracing, but is there another reason for that?
Yeah, there's a range of reasons for that. Clearly, the infection takes time to transmit between people, so when people start their infectious period, when it actually is visible on the test, and the isolation, of course, starts at the outset. The isolation periods and the quarantine periods are also different depending on each individual case and the nature of the household. So if you're you may start as being a close contact. That's when you start your isolation. You may then become a positive case, and you then start your quarantine, then you start your isolation. So there are different processes in place for that.
I guess I just wonder how it's spread to, say, a third household when you've got the first diagnosis on the 6th, the third gets the diagnosis on the 11th, the next one on the 17th. Like, that's a big gap. So they shouldn't have been seeing each other.
Correct. They shouldn't. They shouldn't have been seeing each other.
Were they
That's
seeing
quite
each
right.
other after they were isolated?
Absolutely. So there is evidence of some contact between households post isolation quarantine. That's kind of the point.
Thank you.
Okay.
Any other questions?
When are you taking a break from the podium from your...
I've got a bit to get through this week, and I'll update you, keep you in suspense.
I just had one. It's not very significant, but I want to get it in. We've been contacted by a number of regional gyms, and they're very concerned with the 1 person per 8 square metre rule.
Yes.
For many of them, it means that there can only be 3 or 4 people in the gym, which is not financially viable for them. Is there any chance to change that to a 1 per 2 square metre or 4 square metre?
No, sadly there isn't. And
Has it been considered?
All of these rules are considered. 1 to 1, 1 to 2, business as usual versus 1 to 8. And if it was safe for people to be closer, if it was safe to have more people in smaller spaces, then of course we would. There may come a time, and let's hope that sooner rather than later, where we can change those settings. The best way to be able to do that is if those businesses do in fact open, and maybe even in limited circumstances, and establish that the rules we've got are safe. That's when we can go one step further. I know that this industry has been hit very hard, and I know that the Minister has been speaking with people from the industry, and if we have to reach out again following the announcements we've made today, then we absolutely will do that. If they need further support, then we're always happy to look at that.
Will it be 1 per 8 square metre for Victorian metro gyms as well? When they
Yes, I think that's what I announced earlier on. The settings are identical.
Yeah, okay.
Did I misspeak, or have you?
No, I don't know if I heard it.
Let me take you through again. Sorry.
No, it's okay. I can read it. I just didn't hear that.
No, excellent. No worries.
And do masks have
I read out what you're reading now.
Sorry, do masks have to be worn in gyms?
Sorry.
Do masks have to be worn in gyms?
I'm not sure.
I think so.
Yes, the Chief Health Officer's just confirmed yes. But look, let's chase that up for you. They're not opening tonight. They're opening, in a little while. Let's go back and double check that, as we have done a few times. It's always best to get the right words once rather than anything else.
A non-COVID question.
Is there a reason Professor Sutton hasn't said anything today?
Because you haven't asked him any questions.
I know, but it's just such a big day.
Do you feel like you need to? I can
No,
leave
I'm
and
just
he
curious.
can do another hour if you want.
Part of the strategy, and he's got nothing to say.
He's happy to answer questions, or he might be even happier if I was simply to say, I'll thank, on behalf of all Victorians, I'll thank the Chief Health Officer and his deputies and the team that he leads, thousands of people working hard alongside millions of Victorians to deliver the numbers that we have been able to report today, and the opening up we've been able to announce. If there's no other issues, thank you, and we'll see you tomorrow.